everyone, both in person here in New York and online. My name is Yanis Ben Amor, and I am the Executive Director of the Center for Sustainable Development here at Columbia University. And it's my absolute pleasure to welcome you, both in the virtual space and in reality, for our very exciting talk today with Professor Selma Karabey. So just a few words about CSD. CSD's goal is to develop innovative solutions to reach the Sustainable Development Goals by 2030. And we have several fields of activities that we excel at, particularly in health and education, gender, and ICT. And in 2017, we came to the strong realization that the Sustainable Development Goals would not be reached unless we also help tackle the problems that are faced by migrants and refugees worldwide. And so in 2019, we launched the REACH project, Refugees Act and Communicate for Health. It is a regional project that is based in Turkey, Lebanon, and Jordan. And the purpose of that project is to provide health information as well as health access to not only refugees and migrants in those three countries, but also vulnerable populations such as the youth. So from day one of the key partners in this project was Professor Selma Karabey. And I will never forget the first time that we met in a small cafe in Istanbul ahead of our first stakeholders meeting in September of 2019. And there were two things that I was sure about right there. First one, she will be an amazing partner for the REACH project. And number two, she will become a lifelong friend. I'm very excited about that as well. So since then, the project is now in our second year. And as I predicted with my first prediction, Professor Karabey has been an incredible partner for the development and the successful implementation of our project in Turkey. So let me give just a little bit of her bio before I introduce her topic. So Dr. Selma Karabey is Professor of Public Health at Istanbul University. She currently serves as the Chair of Postgraduate Education Program on Public Health at the Istanbul Medical Faculty and the members of National Committee of Program Developing on Public Health Postgraduate Education. She has worked as a Senior Advisor of National Program on Multi-Sectoral Health Approach, led by the Turkish Ministry of Health, and has been acting as a board member of the BIRIZ Association, which is performing community mental health. She's also part of the Task Force on Vulnerable Population for the Lancet COVID-19 Commission, which is based at CSD, and obviously has been a critical member of the REACH project. So her major interests are mental health promotion and social policies in health. And today, her topic will be responding to the needs of refugees and migrants during the pandemic Turkey's experience. Professor Karabey, it's a pleasure to welcome you at CSD.
Thank you, Yanis. Thank you for your kind words in order to introduce me. First of all, let me express my feelings. I'm so happy to be here with you. And also, I'm so happy to be hosted by you, Yanis, Özge, and the Earth Institute, actually. And so today, I'm trying to give you some concrete information about the Turkey's experience on refugees and migrants. As you see, Turkey has a really big population of migrants and refugees, rather in a short time, actually. And so, as a country, whole components of country, actually, we had to and still have to respond something during the process. And so I think that this experience would be benefit to all of the people who try to create a sustainable world, sustainable development. And so I wish you a fruitful meeting, fruitful gathering, and please do not hesitate to stop me during my speech. You can ask your questions you can make your comments, etc. And so here is very cozy environment, and so we can discuss all together. Okay, in the beginning of my speech, I would like to give you a background picture, actually, as global trends. This report was released recently by UNHCR. In this comprehensive report, UNHCR discuss the some aspect of the global trends on forced displacement in 2020. There are, of course, some summary numbers, highlights. For instance, recently there is more than 80 million forcibly displaced people worldwide. And unfortunately, more than 80% hosted in developing countries. And of course, there are some conclusions of this reality. And more than 70% of those peoples are hosted in neighboring countries. And all of them, almost all of them, are among the developing countries, actually. And Turkey is the first country in which the largest population of refugee population has been hosted. And all of the forced migrants all over the world, most of course, originated from the 5 countries. The first grade is Syrian Arab Republic, and in Turkey still it is the most crowded population among the refugees. And second one is Venezuelan people. Third grade is Afghanistan, South Sudan, and Myanmar. And by the way, about 1 million children were born as refugees. They opened their eyes as refugees. And unfortunately, only very, very small part of those people have been resettled all over the world in 2020. And according to the UNHCR, this number reduced after the pandemic. It is the direct effect of pandemic about the process of resettlement. And of course, we need to have greater responsibility as a global community. We need to have a greater responsibility and to share the burden of all this migrant process. But the reality is not that, unfortunately. High-income countries host only about the 17% of all people displaced across borders. And about half of the people are hosted by upper middle income countries like Turkey, Colombia, Iran, Lebanon, Jordan, etc. And it is so striking that lower middle and low income countries burdened really a big responsibility. On the other hand, their resources are so limited, and it is not enough, even not enough for their, for instance, kids in terms of education or in terms of health services. They cannot provide those services to their own population. And plus migrants and refugees, everything is worsened. Yeah, please, Yanis.
So just like in the upper middle income countries, it seems like the countries that you have highlighted have the majority of the 43%. Can you say the same about the high income countries? Is it like 2, 3, 4 countries that have the most of the refugee? Okay. Great.
As you can see, there is only high-income countries among the host countries at the end of 2020. One is Germany. Germany places first 3 actually, and we know the Germany's effort to share the burden, and also United States. The other ones you can see upper middle income or lowest income countries actually. And in terms of registered Syrian refugees, because the number of Syrian refugees is the most biggest one. And so Turkey is first grade, about 3.7 million registered Syrian refugees at the end of 2020. And Iraq, Egypt, Lebanon, and Jordan. Of course, if you compare the proportion to the nation's populations, then their burdens would be higher than Turkey. This is the people, a map, refugees, people in refugee-like situation and Venezuelan displaced abroad. And you can see some scale. And as you see again, in Middle East and in all over the world, actually, Turkey is the biggest hosting country. Also, you can see the countries of resettlement in this year, actually. Among those, yeah, again, Germany, and this one is Sweden, I think, Canada, and United States. And UNHCR is discussing about the next projection. It says that the magnitude and severity of food crisis because of the climate change and pandemic worsened in 2020. And so forecasts for this year are equally worrying in displacement affected countries like South Sudan, Syria, and Central African Republic. And also climate change is driving displacement and increasing the vulnerability. And so our world should respond as a total, actually, not the only countries. Some countries' responses are enough for that, but we should respond as a global community as a whole. And when we come to Turkey, Turkey has a population of more than 80 million, except refugees, of course. With refugees, the number is closing to 90 million people. There are about 3.7 million Syrians under temporary protection. I will give some brief info about those situations. And also, there are 400,000 asylum seekers and refugees under international protection in Turkey. And besides, more than 1 million irregular migrants. And so totally, approximately, we have 5 million, migrants, refugees in Turkey. When we look at the legal regulation on immigration in Turkey, the Convention of 1951, Geneva Refugee Convention is named. But Turkey has signed this convention, and according to that, Turkey doesn't accept the refugee from the Eastern country, only Western, specifically from European countries. Turkey accepts some refugee application. But after the Syrian war, in a rather short time, millions of Syrian people came to Turkey. And so there should be something to do by the government. But at least 2 or 3 times we tried to make it include, actually integrated to the community, but the number is so high, and so we needed some laws, some official regulation for that. For instance, there are many kids who need to access to educational services. There are many people need to access health services, work permission, etc., etc. There are many things regarding the migration life. And so finally, in 2014, a special law published for that. The name of this law, Temporary Protection Regulation. This law mainly published for the Syrian refugees, but anyway, it also includes some other refugees as well. And when we look at the Turkey's position as geographically, during the history, Turkey has taken a lot of migrants actually, but most of the migrants used Turkey as a transit country, and the main purpose is to go to the Western countries. For instance, it is still similar. For instance, from Pakistan, Afghanistan, Iran, and ex-Soviet countries like Turkmenistan, Uzbekistan, Tajikistan, etc., many people are coming to Turkey. Some of them are staying, but some of them are going somewhere else. These are the main migration routes from Asia to European countries. And if we start to talk about the COVID-19 and the migration issues, of course, there is already many problems regarding with migration. And plus COVID-19, the situation has been worsened actually, because the main reason for that, COVID-19 induced economic recession almost all over the world. Because of that, income loss has been occurred. And so, because of the income loss, the coping strategies of the migrants and refugees has been limited. And of course, living standards have been reduced. And because of that, there are many others chain reaction actually. And accordingly, in Turkey, the refugees and migrants have faced many difficulties because of the pandemic. First of all, working conditions became more difficult actually. Most of the migrant people, as you can imagine, are working in informal sector, and so they have no documents of work, and they only could earn some low salaries because of the pandemic. They don't have the right. For instance, some transfer, cash transfer, also it is not so much in Turkey, but anyway, they couldn't benefit from some cash transfer given by the government, for instance. And also the rate of job loss is quite high among the migrant population. And so, just before the conference, we have talked with Özge, and we talked that the population, the migrant and refugee population living in Turkey are the poorest and low educated one, because the other ones could go to the other countries easily, for instance. They could get some acceptance so easily, but those living in Turkey have much more difficulties, and so they have to live in crowded houses. During the pandemic, social distancing would be impossible for them. The mean number of households among migrants in Turkey is about 6 person in a house. Can you imagine? You live in a house, maximum 2 rooms, and so with 6 people, you are talking about social distancing. It is of course impossible. And because of all these factors, the stressful life happened for many people because of the high levels of uncertainty about the future. And during the pandemic, the stigma and discrimination has also been increased, unfortunately. And also fear of getting sick and not being able to benefit from healthcare services is another stress-provoking factor. And also many refugees, even if they were sick, they couldn't access the health service. Otherwise, they would be deported from the country. And anyway, fear of deportation is an obstacle, is a barrier for getting health services. But of course, we had many difficulties during the pandemics. On the other hand, many responses would be created and occurred, fortunately, of course. I would give some information about the Sıhhat project led by Turkish Ministry of Health. Sıhhat means health, well-being in Turkish and in Arabic also. Sıhhat project founded by European Union and launched in the beginning of 2017, aiming to support and improve primary and secondary healthcare services provided by the Ministry of Health to Syrians in Turkey. The first phase has been ended and the second phase has started, and universal health coverage is about more than 80% among the registered, of course, migrant population in Turkey. It seems very reasonable. And also, Turkish Ministry of Health provides COVID-19 vaccination to all of the registered migrants, refugees in Turkey. I would like to give some brief info about the Sıhhat project. During the pandemics, an intensive health education messages were given by the project through the leaflets or through the websites, etc. You can see in Arabic, in English, and in Turkish. There are some health messages, some knowledges about COVID-19. During the Sıhhat project, about 200 migrant health centers providing some primary health care to the refugees, to about 200 migrant health centers have been established in 29 provinces in Turkey. Of them, about 50 migrant health centers have been established as powered, strengthened migrant health centers. It means that some plus the primary healthcare services, some internal medicine, gynecology and obstetrics, pediatrics, and the dental health services, laboratory services are provided by those centers. And there are 10 community mental health, migrant mental health services also targeting the refugees. And they provide some chronic mental health problems chronic mental health disorders, and also chronic psychiatric patients receive medical treatments and some social support in those centers. And it seems very important to me, the people, the professionals working in those centers, most of them are Syrian ones. There are totally 3,500 people working on the migrant health centers, and about 90% are Syrian ones. This is really a good employment strategy to me, because the main barrier in order to access the health services is the language barrier and cultural barrier. And so if you employ some people, some doctors, some nurses, etc., with the same culture of the people, and so those barriers don't exist anymore.
Can I ask?
Sure.
So 2 questions. Do they have to be bilingual in order to be hired? Or since they are specifically working with the Syrian community, is that not necessary? Number 1. Number 2, is their salary equivalent to what the same job from a Turkish person working in the Turkish health system would be?
Your first question, most of the personnel actually are not bilingual. Most of them only speaks Arabic and maybe some of them English. But in every migrant health centers, there are some bilingual translators, or not only translators, they also help to directing the patient to the regarding service. They help them, etc. And they are bilingual or trilingual maybe. That's the first questions answered. The other one, I don't know very well actually. Maybe Özge, do you have any idea about these salaries?
I don't know.
Mm-hmm. But I will ask for you. Yanis,
It'd be interesting to see whether there is a lower salary because they are foreigner and they don't.
But I don't think so. I think they are. I mean, the salaries are similar to the healthcare workers in Turkey.
So this project is based on international human rights perspective. And I don't think so.
I also don't think so.
I will check.
Because I mean, the Ministry of Health employs them, and I think the rights are similar. The salaries should be similar when we compare them. I mean, of course, it will be different according to the profession and the rank, etc. But I don't think that it's different than the Turkish healthcare workers.
Just before coming here, I visited a migrant health center in person. I wanted to see in detail the working conditions and their attitude, etc., etc. And I have talked to doctors, nurses, and social workers, etc. They all seem to be happy, actually, to make this job. And also the people taking some services from there seems also good. System works very well, and the physical conditions, of course, all of them may not be same, but physical conditions are also very good. And on the other hand, this center is settled on very poor neighborhood in Istanbul, just behind back streets of Beyoğlu, Beyoğlu, and a very poor neighborhood. But the physical conditions of the building is very good. Okay. And another good example for this project is the strategy of gender equality. And so about 1/3 of the healthcare workers working on those centers are selected from women. It is very important, of course, in Turkey. And vaccinations program works very well, especially child vaccination program is very well. For instance, when I asked to visit the center, they said that if possible, please do not come on Wednesday, because Wednesday is the tuberculosis vaccination of ours, and so it will be so crowded here. If possible, you can come another day. And so vaccination program works very well. And also cancer screening program works among the refugees under the umbrella of SIHAT project. As I told you, more than 400,000 people have been screened cancer, breast cancer, cervical cancer, and colon cancer program are being performed in Turkey. And vitamin D and iron supplement also is being provided by the Migrant Health Center to the children and the women. And what about COVID-19 vaccination? This map belongs to the Turkish population who has been vaccinated. The blue ones is the higher vaccination rate. The yellow is less. For instance, the red is the worst in all over the Turkey. And Turkey has reached about 80% vaccination rate, of course, in terms of targeted population, not whole population. And unfortunately, these rates are not so high among the migrant population in Turkey. There is no official report for that, but I know some trends, some info about 22% actual vaccination rate among the migrants. The main reason of that, the effect of vaccination, COVID-19 vaccine, is underestimated by the migrant population. For instance, some outreach workers said that they don't care the effect of vaccination because they say that, oh, we lived many wars, we lived many conflicts, and so COVID doesn't make anything to us. And also there are some, of course, misinformation about the vaccination, etc., etc. And now I would give some specific info about the groups that most affected by COVID-19. Of course, children are the first affected population. There are some inequalities in access to education in terms of migrant population, and also during the pandemic, increased child neglect and abuse. About education, in Turkey, approximately 1.6 million Syrian children are of school going age, and it covers the 75% of all children between 5 and 17. And you can see the school enrollment rate is here. for primary school, it's about 80%. Of course, it is not wonderful, excellent, but anyway, not so bad actually. If you compare to the other countries, for instance, in Turkey, the situation is not so good because there are many efforts to integrate the national education system. But in middle school and in high school, you can see the decreasing, the reducing rate, and the proportion of young people going to higher education seems not so high. But again, if you compare to, for instance, global percentage, about 3% in all over the world, 3% of young refugee population only go to the university, according to the UNICEF. But in Turkey, the proportion is not so bad. It's about 2 times higher. Okay. Sorry.
Can I ask how that compares to Turkish citizen? So you have 80, 79, 39, 6.7. Like if you are Turkish, what is the enrollment rate? How does that compare? And then the second one is obviously a huge drop between middle school and high school, and then another huge drop with higher education. I wonder how much the language is an issue. Because when you're a child, it's easier to learn a new language. When you're an adult, if all of the teaching is in Turkish, I wouldn't go to a higher education just because I won't be able to understand what they teach, even if I have the, I don't know, intellectual capacity. So how much of that is the issue?
Yeah. Of course, language is one of the issues, but the main issue is economical one. Most of the children should work in order to have the budget of the family, because I mentioned before, they only earn low salary. For instance, half of the Turkish workers. And so most of the children have to work. But of course, the among the other factors, the language barrier, but mostly cultural or discriminative factors. Because, for instance, at the first, let's say 5 or 6 years ago, even teachers didn't have the capacity to overcome the difficulties because they didn't have the education accordingly. And many projects have been done during the years. And also Ministry of National Education organized many training programs for the teachers. And nowadays, the situation is better. But because of the pandemic, there are still many difficulties in the country. And your other question, regarding the other question, these numbers is about more than 90%, 95% actually. I don't know the exact numbers of the others, but it is not, it is not difficult to say much more high. Okay. And during the pandemic, Ministry of National Education is created a distant education system, and the education went on through the special TV channel, national channel, and also internet. The name of the system, EBA TV. TRT is the national TV channel, and some part of this channel organized for the distant education. But of course, that there is no TV, internet for distance education among the migrant children. And so seasonal agricultural work is very common in Turkey. And because of that, unfortunately, the rate of school attendance reduced during the pandemics, and the, of course, risk of child labor has further increased. And maybe you know that International Labor Organization says that the seasonal agricultural work is one of the worst forms of child labor. But unfortunately, there are many children in Turkey have to work as seasonal agricultural worker. And on the other hand, by UNICEF and by other international agencies, the conditional cash transfer for education program has been started. It is a very successful program in Turkey, and it has been lasting about 20 years. And the rate of, for instance, girls of attending the school is quite high because of this program. And also it has started now for the migrant children in Turkey. The partners of this program, of course, Ministry of Family and Social Policies of Turkey, and Ministry of National Education, Red Crescent, UNICEF, and among the founders, European Union, Norway, USA.
Sorry, can I ask?
Sure.
So it's conditional cash transfer. What's the condition?
At least 80% attendance is required. For instance, in a month, a kid should attend the school most of the time, 80% of the time, maximum 4 times may not go to school. Otherwise, the transfer has stopped. But not only stopped, it seems very good to me if, for instance, a kid doesn't go to school more than 4 days, for instance, in a month, then some social workers visited the family, and they are searching what is the reason of that, and if possible, they are trying to solve the problem, and they are giving some education to the family, etc., etc. And so, hopefully.
So this is money that goes directly to the parents.
Mm-hmm.
Yes. And is there also a condition on how the money is used?
Mm-hmm.
So I know programs from the School of Social Work, for example, in Uganda, if I'm correct. I don't know why I looked at you, not School of Social Work, but where they were looking in Uganda at keeping girls in school, and the money had to be used for the girls' education. And this was to make sure that the money was not used on non-necessity things like alcoholic beverages or things like that. So is there a condition also on the expenditure?
The transfer is carrying out by Kızılay card, Red Crescent, Turkish Red Crescent cards, some kind of credit card, for instance. Of course, you can only buy some foods or some necessities for that.
We have a system here in New York or the US?
US.
Where where you have a specific credit card
Yes.
for lower income families, and it can
Yes.
be used for the purchase of certain food
And the
necessities.
aim is to help financially to the family. And so the national education program is free, totally free in Turkey. And so the only need is to help the family's budget. Aim is that. You can see some photos from those cash transfer program. And also, under the umbrella of this program, there is some non-formal education programs. For instance, some kids drop the school and they have to work, for instance. But anyway, some other additional educational programs are provided to them. Some vocational program, some language courses, for instance, some homework support, etc., etc. And you can see the number of the children who benefit from the non-formal education program and from the outreach activities. And there is a story of a family. The name of this girl is Zahra, and because of the cash transfer program, Zahra continues to do her picture. And I'm sure you know about the No Lost Generation initiative. It seems also very important one. And there are many international NGOs and UN agencies under the umbrella of this initiative. And their main purposes are to support the education of migrant people, migrant children, and child protection, and also support the adolescence of youth. And this initiative says that we need to ensure continued support to education, build inclusive, resilient, and flexible education, priority support to teachers, etc., etc. And in the last 5 minutes of my speech, I want to talk about the other under-risk groups, about women. During the pandemics, gender-based inequalities have increased, we know. And also violence against women increased. Workloads and withdrawal from working life increased. And unfortunately, unwanted pregnancies increased. UN Women mentioned about the shadow pandemic because violence against women during COVID-19 has been increased. And gender inequalities deepened. And also, I will mention shortly, there are many NGOs working with the women in Turkey. But during the pandemic, all works, turned to online. And so those women who has been faced violence, unfortunately, they couldn't get some enough support mechanism, some social services, etc. And investment of women empowerment is should be most priority to me in terms of education, employment, and reproductive health of women. In Turkey, there is a national demographic and health survey carrying out in every 5 years. In the last one, Syrian women have been also covered in this survey. And so more than 2,000 women interviewed. Total fertility rate among Syrian women is 5.3, sorry. This number is 2.3 among the Turkish women, more than 2 times, as you see. And about 40% of young women aged between 15, 19, known as adolescents, we know, are either pregnant or have at least 1 child. And so early marriage and early motherhood, child motherhood, not early actually, is so common among the Syrian refugee women. For instance, the Syrian woman aged 2024, about 10% married before age 15 and 45% married before the age 18. And the early marriage and early motherhood is closely correlated with the educational status. If the education level of women is low, then unfortunately early marriage and early motherhood is low. For instance, we talked with you, Özge, this fact. For instance, among the women who have no education or incomplete primary school, total fertility rate 5.8, complete high school and higher 4.1. Even this number is high, very high, and so it is rather a cultural fact, but it is needed to work on it. Actually, it is. Yeah.
Okay. Maybe dumb question. We're looking at the education level of the wife. I think it should be paired with the education level of the husband. I don't know whether there's actually a correlation. If she is higher education, is he higher education too? Maybe there is a one-to-one equivalency. But I'm wondering if he has lower education level and the culture playing in, doesn't matter that she's a triple PhD, her fertility rate may still be decided by him rather than her.
In the demographic health survey data, you can find some numbers about the husband's education level and comparing the one. But of course, I didn't bring all of them here. Anyway, you can easily reach this number during the after the conference. And contraceptive use, for instance, modern method is only half of the Turkish woman. And this is another activity campaign of no loss generation. Marriage can wait, but childhood cannot. This is the numbers about the employment of Syrian women in Turkey. It is so low, as you see. And in terms of NGOs, there are many NGOs in Turkey, and they are really carrying out very successful studies, activities, because they have huge flexibility and their work is solution-based. And most of them gained trust of the refugee communities, and they are in the field directly. And you can see some NGO network in Turkey, especially after the Syrian war, the number is increased very much. There are some slides about the Turkish Red Crescent. Anyway, I'm finishing now. there are some activities for migrant women in order to gain some money, some food production, some clothes production. There are some vocational education, etc., etc. And yeah, this is last slide, I think. International Organization of Migration says that migration is a multidimensional reality that cannot be addressed by one government policy sector. And migration and migrants' needs are considered across all policy areas, laws and regulation, from health to education. And so they name the approach as whole of government, whole of society approach. And I say that the only solution is solidarity among people, solidarity among agencies, countries, etc. Thank you for your attention. I hope I use time.
Perfectly.
Yeah.
Thank you.
Okay.
Thank you very much, Professor Karabey, for this informative talk. I think we can now open the floor for questions and comments. So, anyone who wants to ask a question? Yes, please.
First of all, thank you for such a comprehensive presentation. It was very informative. I noticed on the slide about the non-formal education that there was quite a big number of 5 to 17-year-olds, and I was surprised by that young age. And what's the thinking behind being in non-formal? Is it a kind of remedial program? Are they being ideally mainstreamed back into the formal system, or are there some young children who are in some kind of? I'm just curious to know more about that.
Yeah. I think the second thing you said is true. And so the main purpose of the non-formal education is taking the kids to the mainstream education in order to help them to get the mainstream of education. But of course, it would be difficult sometimes. And so during this process, some other educational facilities would be helpful for those kids. Thank you.
Yes, please.
Thank you so much. My name is Daniel Naujaks. I direct the UN Studies program at School of International Public Affairs. And I am a migration researcher. I've done a lot of research also on Turkey, on Syrian refugees in Turkey, and I spent some time with students in Turkey. So I really appreciate the background and the details of your presentation. I've two questions about transitions, about the labor market report, because I know that the temporary protection regulation is very limited in terms of actually giving the right to work. Right, in theory, it's given. In practice, it's not given. I don't know the actual number right now, but I think it was something like 5% of working age Syrians actually got the work permit, right? Because it's so cumbersome to get it. You have to sponsor. I mean, you know much better than I do. There's two questions. One is, if this were scaled up, so I understand in this project where these health workers are employed directly by the Ministry of Health, I assume a lot of the red tape that exists for private sector hires falls away because it's the government who's doing that. But still, what kind of formal challenges are there, especially if you think about scaling this up? If you think about other doctors and nurses and healthcare professionals being employed, not just in, I don't know how many you have in the project, but more large scale, how much would the work, the lack to access to the actual work permits be a hindrance? And then connected, a little bit connected, but not completely, is we often think about education as a big enabler. Like education and people can help themselves, etc., which is in refugee settings only partly true. Because if people are educated, but they can't get formal jobs because of work permits, they can't have them, then the entire theory of change, how more education leads to better outcomes, is problematic. So how, if you work with these people in the education system, how do you address the possible transitions to actual better outcomes and incomes and employment, and the possibility that, well, if you can't find an employer who actually sponsors you for this job and has to show that no other Turkish citizen is equally qualified, and that means in most jobs you will not get a job unless you become a Syrian cook. So how do you address it in the entire educational outlook for not just giving them the skills, but thinking what can they do with the skills afterwards?
Just after the Syrian war, of course, many highly educated people came to Turkey from Syria. And we heard many sad stories about them, actually. For instance, while in Syria, he is a highly qualified judge, but in Turkey, he is working as a seasonal agricultural worker. It's so sad, really. The main problem on this issue is to prove the education level. For instance, somebody says that I'm a nurse or I'm a social worker, but they cannot prove their education because they may have lost their papers, etc., etc. But nowadays, Turkish government felt that this is really a very important human resources in Turkey as well. And so now some solutions are being developed in order to prove some equivalence, some education level. On the other hand, the unemployment percentage is quite high in Turkey, even among the graduates of university, for instance. And so it is not true in the health care workers. It is still good position for them in Turkey. But for other sectors, for instance, some economics or some social science, it is really difficult to find a good job. And of course, it is much more difficult for the migrants one. But anyway, Turkish government is trying to make some regulation nowadays, but I agree with you, it is a problem for that. And also, we are carrying out a study with a Syrian American Health Association and among the Syrian doctors and the other healthcare workers in Turkey. And I hope that in near future, we will have some concrete data about the problems, about the daily life and about the finding a job, etc., etc. Maybe you can add something, Özge.
I mean, actually, you already, I think, mentioned the main points, but yeah, I mean, the government, obviously, the authority on migration, they are trying to find ways both to have vocational courses and then to increase education, I think, etc. But then also to improve employment opportunities. But the country's own economy, the informal sector for the citizens as well, and lack of, let's say, good job opportunities for everyone, including citizens. That's also a very big problem because I mean, what affects citizens also affects the migrant refugee communities in a double or triple way. So I mean, everything is connected probably, all the social determinants of employment. So I mean, the situation is not really good for the citizens as well. The employment in the formal sector and informal economy is growing.
For instance, among the young people, about 25% unemployment rate, more than 25% among the university graduates. It's so high, really so high, so sad. And so for young people, living in Turkey is very challenging issue. Thank you for your question. Please.
So I would like to know a little bit more about the temporary protected status. So it was started in 2014. Once Turkey realized, okay, Syrians are not going anywhere, right? From 11 to 14, there was this idea, the situation can get resolved, they'll leave. In 14, it's like, okay, they're not leaving. What are we doing? I mean, I'm simplifying, of course.
But what the EU was saying, you need
Yes, I know. And so what is the plan now? Is the idea that it's going to be temporary forever? Is there a timeline after which you say, is there a timeline after which you say no more temporary protection? Or is there a situational timeline if the regime in Syria changes, or if, I don't know, the war stops? And then what will happen with all of those migrants and refugees? Is the idea that they will go back voluntarily or involuntarily? And finally, is there a pathway to citizenship for anybody who wants, or is that absolutely out of the question?
It's, I'm sure there should be something on the mind of decision makers. And everybody knows that in reality, of course, nobody goes nowhere. And so they are not temporary people. They will stay. And so we should create some solutions, some realistic solutions. But we have many other important problems as a country. And so I don't know any precise plan for the future, actually. We will see.
It's not announced.
And I think like 2 years ago, Erdogan announced a special initiative where like very highly skilled businessmen of Syrians could gain citizenship. And that backfired politically a lot. There was a lot of backlash about, oh, you want to change the Turkish populace. And I'm not sure any person actually got ever like citizenship under the scheme. Yeah. But under the TP, they are not eligible with a special regulation that everyone had thought of.
Actually, I mean, there are a lot of people who got citizenship. I think it should be, I mean, it was more than 100,000.
Really?
In number, yes.
And
so there is a pathway.
What made them special? Like why them and not the other ones?
Either
is it
they are
skilled
employed, they can, get married to a Turkish citizen, or they can invest, like make an investment. They can buy a house, or they can employ Turkish people, etc. So just like the visas in the US.
All the ways that.
So there are different ways to get citizenship, and there are like thousands of people who got citizenship. But of course, I mean, the majority has the temporary status. The thing is, of course, behind the doors, there should be plans like short-term, mid-term, etc. But there's no official policy or document. That describes the short-term, mid-term, long-term plan. And of course, I mean, there's the political side. There's increasing stigma, discrimination, and the nationalist movement is stronger now. So it's difficult to talk about these issues, especially by the policymakers, decision makers. But when we look at the studies that ask refugees if they want to stay or leave, most of them want to stay. that we know, especially younger population, especially women, they don't want to go back because of the, better, let's say, gender-related conditions. They can at least, work. They can access the services. Their kids are, getting educated, etc. And I mean, when compared to certain human rights, women's rights, etc., many women, they want to stay.
Until for instance, last 3 or 4 days ago, most of the NGOs were providing some services for trauma, for instance, resolution work, some support, some social support, etc., etc. But nowadays, they are making their project with the vision of integration, because they are more realistic. The NGOs are more realistic. Also, international NGOs and UN agencies, I think, handle this issue in terms of integration. But yeah, we don't know some exact announcement about that.
Thank you.
Okay.
Is there any other questions, comments? Okay, so maybe it's time to conclude and thank Professor Karabey for being here with us and accepting our invitation to be here. It was a pleasure having you here, and I also would like to thank our participants online for being with us. I hope it was a fruitful and informative session for you. So thank you so much for being here, and have a nice rest of the day.
Thank you very much for your invitation. It's so pleasure for me to be with you.